Kelly Mietnin. I'm the Executive Director of ALD Connect. I want to thank everyone for participating in our 2021 Annual Meeting in Patient Learning Academy. I hope you have enjoyed all the sessions so far. This webinar on navigating the financial aspects of ALD is a special session that was made possible by a rare patient impact grant from Global Genes. We have been preparing for this session for many months, and in doing so, we realized that this topic is very broad, complicated, and in many cases dependent on individual circumstances. That said, I think this will be a great place to start, and I am so excited to introduce you to our wonderful panel. We have two ALD moms, Kirsten Finn and Jillian Smith. We also have Debbie Jacobson, the Senior Manager of the Patient Support Center at Be the Match.
Recording in progress.
Emily Hardy, who is the Leukodystrophy Care Coordinator at Primary Children's Hospital in Utah. Please post your questions in the chat. We will try to answer them now, but if we're not able to, we will do our best to find answers after the webinar. And we also plan to have some subsequent webinars on financial topics in the coming months. Please note that this webinar is for informational purposes only. The discussion is not intended to be a substitute for professional medical advice, diagnosis, or treatment. If you or a family member are ill or suspect that you are ill, please seek professional medical attention immediately. ALD Connect does not recommend or endorse any specific physicians, treatments, procedures, or products, even though they may be mentioned during this webinar. So let's go ahead and get started. And first we'll hear from Kirsten Finn.
Okay, good afternoon, guys. Thanks for having me. So my name is Kirsten Finn, and I am the proud mom of two almost 11-year-old twin boys and a 5-year-old boy named Connor, who was diagnosed with cerebral ALD in June of 2020. Our situation is going to be a little different than a lot of you. We're from Canada, and at the time that Connor was diagnosed with cerebral ALD, they had shut down all pediatric diagnostic procedures. And so at the time we found out that he had to be tested, they were telling us it could be up to 8 weeks before we received an MRI. And between the time of when we found out he had to be tested and when his long chain fatty acid came back, I searched rather relentlessly at various Canadian centers, and they weren't able to keep up with the demand for stem cell transplants. But in addition to that, there was no identified person in ALD. So had we remained in Canada, we would have been looking at a very delayed transplant with an inexperienced provider. And we just didn't feel that was a risk that we could take with our son's life. So I contacted Dr. Troy Lund at the University of Minnesota, and he really generously helped navigate the process for us and getting us down to Minnesota for transplant. Many of you may know that the Canadian system is a publicly funded healthcare system, meaning it's not like you can prepare for a scenario like that. You have to go into the public system. The wait times are very long. We did actually have an insurance policy just in case something really bad happened and we thought we might have to go out of country. But as we went through that process, we discovered that because it was a pre-existing genetic condition that we would get no coverage with regard to that. So the day that Connor's long chain fatty acid test came back, I looked at my husband and I said, I think we're in trouble. And so we went and we liquidated retirement savings and proceeded to go to transplant. I can still remember the day with Dr. Lund. They couldn't tell us in Canada if Connor was in the window for transplant. And so we headed down to Minnesota. And that day, Dr. Lund is, well, what are your questions for me? And all I wanted to know, well, can we do anything? And he said, yes, but we need to move quickly. And he wanted to know what kind of options were available to us. And I told him that I wanted him here in Minnesota, and he just looked at me and said, well, do you understand what that entails? And I think he could tell from us when we were there, we meant business, that ALD is not something you mess with. And so we then proceeded to do that. We applied for out-of-country coverage through our provincial government, which we should get considering they don't do pediatric bone marrow transplant at all in our province. And we were denied. We then appealed to our Health Services Review Committee, and our appeal was upheld 2 weeks before we started our workup in Minnesota. but they withheld that decision from us for over 2 months while we were in transplant. So we're kind of engaged in a bit of a battle now. So to make a long story short, a lot of your situations won't be like mine, but most of you, I think, are probably newborn screen families. And although it's hell going through that 6-month MRI cycle, it does put you in a really good position to prepare in case you do need to go to transplant. And since we went to transplant on the fly, it was kind of trial by fire, but we picked up a few things along the way. And Kelly asked me to speak with you today about some of those things. So having been through what we went through, if I could make any recommendations to you, is whoever you have as your primary care provider, to find somebody who you know is really going to advocate for you. I think we can all agree that working with insurance companies, having those people in your corner makes all the difference in the world. And while I think it's important to have good local care providers in terms of an endocrinologist, perhaps a neurologist, I think it's crucial for cerebral ALD to be seen by an expert in ALD. I think a lot of you, to save money in the interim, see someone locally, but also have your MRIs sent out to be looked at, just so you're getting that extra set of eyes on them. I've seen a number of people on some of the support groups who have gotten a local MRI and it's been scored, on the less score, but when they actually get it done by an actual ALD specialist, the differences are significant and it can really impact treatment decisions. So I think since you have time to plan, if I could recommend anything, is to get a little folder together and start getting some information so that if you have to go to a transplant and it's go time, you're not having to scramble like we did to get all that kind of stuff together. You might want to think about, if you had to go to transplant, where you might want to get that transplant done, and checking into your insurance to see, is that within your network? Would you be able to get treatment there? How you might make things like that work so that you choose where you're going to go, so you can navigate that way if you should have to. One thing that came up with us was there's a lot of logistics surrounding travel. And, will you drive? Will you fly? Coming from Canada, we found it helpful to have our car while we were living in Minnesota to be able to do things. But then that brings up the issue of liability insurance and getting that taken care of before you head down for transplant. Accommodations, when you do that, are a big factor. I mean, most major centers have a Ronald McDonald House, but I think you want to have a good backup in place too, because, in our situation with COVID, we didn't want to take the risk of being around too many people, wiping out his immune system and whatnot. We don't have any family, nobody who could help us out with the boys. And so we chose to rent out a little apartment across the street from the hospital. There were 5 of us in there for 5 months living on air mattresses, which was pretty chaotic, but we got through it. It also allowed the ability for, if there was a diagnostic procedure, something going down during transplant, Craig was right across the street and he could leave the twins for half an hour to come and help me out with stuff. There's laundry, all that kind of stuff that would come up when you're doing that. Another thing, so when you're looking at accommodations, most of the websites for most of the major transplant centers have good information pages of places they recommend for accommodations where there could be subsidies involved or reduced rates. I would recommend to have, a list of those ready. So, because a lot of people need those services, and always having a backup for those things is a really good idea. Thinking about what you want to do with your other children is another factor that might come up. With our situation, there was really no one for the twins to be with, so we brought them with us. I've met many families who might have one parent stay at home with other children while the other people are in transplant, or even sending their kids to relatives who might be able to help care for them. Other things you might want to consider is schooling for your kids. We kind of got stuck in a situation. I'd contacted our local school when Connor was diagnosed, and they didn't get back to me because I wanted to know, well, what can we do? And we couldn't meet their distance education requirements. So there I was on the internet in Connor's hotel room at midnight, trying to find a school for my kids to go to for that year. But some of those things can have costs, and I think looking apps or your other children. I have another son who has a number of learning disabilities and cognitive things, and arranging supports for them costs money as well while you're not in your home environment. Looking ahead to thinking if you can work remotely and what that looks like for you in your job situation. Thankfully, Craig had a position where he was able to do that. But if not, would you want to look into some type of insurance that might help provide some sort of a baseline income for you while you're going through transplant? If you're leaving your local area, do you need any kind of secondary health insurance, that kind of thing? Because it was COVID and a lot of the services, at least where we were, weren't happening around that time. We were all due for dental work. We were all due for medical appointments. And we just kind of went to Minnesota and hoped like heck nothing would go wrong while we were there. But those things cost money as well. Looking into, depending on your situation and what your transplant looks like, respite care, looking into options for that kind of thing might be helpful as well. I think we went through transplant at a really unique time because a lot of the services like care partners and stuff that is normally available wasn't able to be up and running. And I think if anything is COVID has taught us is to make sure you have a backup plan in place and not just expect certain things are going to be available to you. What else have I got here? I think too, I've seen some really neat things people have done in terms of fundraising. Some people have done t-shirt drives. Those are interesting. When Connor was diagnosed, after we headed to Minnesota, Craig's employer kindly set up a GoFundMe account for us. And to be truthful, at first, I really was hesitant about that. I felt really embarrassed and ashamed to be in that situation. But it did come in handy. I remember having a conversation with Janet, our social worker, and she said, Kirsten, no one judges. And she just said, if people are going to help, be willing to accept that help. And I think the ALD community is just the most amazing group of people who are always willing to reach out and help other people. I think looking into things like what things are going to look like for you post-transplant. As we all know, ALD is very unpredictable. No one really progresses in one sort of standard type of way in terms of what might be impacted. In our personal situation right now with Connor, we have some fine motor deficits. It's interesting, you guys had the presentation just now on the cerebral visual impairment, because we're looking into some vision therapy for Connor. He's got some deficits there and possibly some auditory processing issues as well. And again, looking to insurance, depending on what kind of policy you have through your employer or what you've done, it can really impact those kind of expenses when you're coming out of transplant. I just recently found out, never knew this before, you can have your insurance through your employer, but in certain states, you can apply for a Medicare waiver, which means you can have that as a secondary source of insurance if you meet certain criteria. And I believe in a lot of states that ALD actually qualifies as that criteria, just because it is so complex and because it has the tendency to affect so many of our major functional abilities. And I think, I'm Canadian. I'm just learning about all of this. We recently relocated to Kansas, but a wonderful lady named Jillian Smith is going to come on and talk to you because she's been through it all and she's got some really, really good stuff to share. If you're finding you're having to go to transplant, like really, really quick, by all means, get in touch with me. If you can't reach me, Kelly can always get a hold of me. It means a lot to our family to be able to help other ALD families going through transplant. And speaking of going to transplant, just as I end up here, just a reminder, next Saturday is the Knockout ALD Run, being hosted by the Pershke family out in St. Louis. And all of that research goes to the Lund Lab in the University of Minnesota. And, hopefully none of you ever have to go to transplant, but all of the improvements that can be made in terms of making engraftment happen more quickly and more successfully, and even the investigation of, non-BMT treatment modalities can be really important too. So yeah, contact me anytime if you guys have any questions, and if you're going through that, and I would be happy to answer anything for anybody.
Wonderful. Thank you, Kirsten. Jillian, we would love to hear from you and your experience.
Hey guys, thanks Kirsten, you're so cute. Someone that's in Canada, you know a lot of what's going on down here, honey. You're doing a great job. Kind of like Kirsten, our situation, my son Grady was just about turning 8 years old when he was diagnosed about 3.5 years ago with a pretty significant LUS score of 10. So we had to move like yesterday with this. So we were told originally when we looked into our insurance that for his bone marrow transplant, that Boston Children's would not be covered because they were not in his network. Luckily, I did have some background with insurances working in a hospital for quite a few years. So I knew that that was something you could fight. And unfortunately, a lot of people don't know that. They hear no and they just take it. At the time, we were told that there was only Boston Children's and Minnesota were the only 2 hospitals, and we didn't have time to research. So I was able to argue with the insurance company and explain this. So because of that situation, they did approve for Grady to be treated in Boston. So we were able to do that. We moved very quickly. There was so many things to go through with the insurance that you don't have time to do when you're moving fast like this. So there's lots of phone calls, there's lots of being put on hold, trying to figure out getting things moving. I would highly suggest getting in touch with your hospital or transplant center, their patient advocates. There are people there that can help you push those things along, but honestly, you do most of the work. To really get it going, you have to push. The big thing I tell people that I talk to, just never ever take no for an answer. You can always get around it somehow in some way. It might take a long time. It might take a couple of years or months, but usually you can get it done. While we were inpatient, the social workers would give us a lot of ideas of things that we should do if we asked. I wish, hindsight, that there was someone there that could actually do all the paperwork and start all the filing for you, because a lot of this stuff is just paperwork and filing, and you don't have time to do it while you're in transplant. It is pages and pages and phone calls, and it takes days and weeks sometimes to get this stuff done. During this time, I did, unfortunately, my place of employment chose not to hold my position. So I was not able to keep my job, but luckily the people I worked with all donated hours. So I was able to keep my insurance for about a year. And luckily my husband had insurance that we could pick up after. But what I did learn, and what Kirsten kind of touched on a little bit, is, and I know every state is different, but state Medicaid, ALD, I hate saying it, but it is considered a terminal brain disease. So you can get state Medicaid for secondary or primary insurance. It just takes a lot of work. Grady was denied 3 times. It took about a year, and he was approved eventually for secondary disability insurance. And with that, you can ask for it to be retroed. So they did retro it back to his diagnosis date. At that point, it was about a year and a half. So you can go back and you can reapply for all your co-pays or any out of pockets. But again, it's time. It's a full-time job to do all these things. And they make it so hard, I feel like, because they don't want to have to do these things. Along with the state Medicaid, there's also lots of resources with that you can look into, but you have to ask. They don't publicize these things. A lot of places offer gas cards for your travel expenses, going back and forth to appointments. They help with summer programs, adaptive equipment. It's just stuff you have to ask for. And the biggest help that we got, that we found out about, and I took forever to apply for it, because every time I hear about these things, I think you have to be in a certain financial bracket, but that's not the case. A lot of these things, it doesn't matter as long as you have the insurance. Someone told me in New Hampshire, there's something called the HIP program. And what the HIP program does, you can apply for it. So we did it. The worst they could say was no. And they ended up they covered my husband's insurance premium. So they're covering almost $800 a month for us. That would be coming out of his paycheck. That is covered, and you just fill it out every year and they continue to pay for it. And that's huge for us. I mean, it's hard. A lot of these things are hard to do because they do take so much time, and it just deters you from doing it, but it's there and it's definitely worth it. Again, the Medicaid approval is very hard, but just push and push. They have lots of advocates that can help you. Your medical center usually has places, like I said, and just utilize all those resources. I felt funny about it for a long time. Like Kirsten said, like we had a GoFundMe that was so generous, and my husband had a hard time with it in the beginning because he wanted to be providing for his son, and it was kind of a awkward. And to me, GoFundMes were for children who weren't going to make it, or a horrible situation. So I didn't like it. I didn't want to look at it for a little while. But you know what? You need it. These things add up so quickly, whether, like we said, whether even it's just gas or parking and all the traveling, the copays, all these medications. And medications is another thing actually too. There's a lot of medications that your doctor is going to say, oh, the insurance said that they're not going to cover it or not going to do this. They will. You have to get on the phone yourself, and you have to just fight, and it takes forever. But again, just don't ever take no for any answer that they give you. There's a lot of resources out there. I know, again, every state is different. Some of them are harder. I know New Hampshire is really tough. Massachusetts can be a lot easier, but it really makes all the difference. And I was having a hard time doing it because to me, hearing the word disability can be such a broad range. And my son is doing very well, thankfully, but he does have a few disabilities. I mean, it's kind of is what it is, but they take care of it. There's so much out there that can help you guys. And I think that was all the main bullet points. But again, I think the biggest thing though for our community, the ALD community, and I know we've heard it a lot, unfortunately, people being told that they couldn't go to certain hospitals because of their insurance. There's so many ways around it. And I know like Kirsten they had to just say, I don't care, we're going to save our son and we'll deal with it down the road and stuff. And you have to do that. But there are so many ways here that you can override those.
Great, thank you. Next, we'll hear from Debbie.
Hi, I'm going to share my slides really quick with all of you.
Yep, perfect.
Okay, thank you. Thank you for having me. I am Debbie Jacobson from Be the Match, the National Marrow Donor Program. And you've already heard from the experts. You've heard from Kirsten and Jillian, and what I'm going to add today, I think aligns well with what they've already shared with you. But they definitely are the experts here. Let me move on. So this is just a background slide about Be the Match, just a little bit of an overview of who we are. We are the national registry in the US for patients and families that do need to search for an unrelated donor, so someone that's not related to them or in their family. But we're more than just the registry. We do help patients a lot of different ways. And, one is conducting research, one is growing the registry. We connect patients and families with donors, but we also have a patient support center. And that's where I'm from today. And what I represent is the information and the support that we can provide to patients and families. So you've already heard from Kirsten and going through transplant with her son. We do have a patient support center that if you do end up needing to go to transplant, if your son does, we are here and we could help answer questions. I'm going to just kind of skip right in though, because the focus, of course, today is on financial and insurance resources. There are a lot of different types of insurance resources that you've already heard, just very high level. There's group health, which is usually provided by an employer, like you heard from Jillian. And even when it's through an employer, there can be a lot of different rules of who is the final approver of what. There's individual health. So that's things like the Affordable Care Act and signing up through the marketplace or the exchange. And then public health, which you've heard about, Medicaid. And then of course there's Medicare. So there's a lot of different types of insurance resources. And that's why this subject can be very very complex and very confusing. I'm going to jump quick into high level about the Affordable Care Act, because it is a healthcare law that says insurance companies cannot deny policies or payments for services based on pre-existing condition. So as long as you've had coverage and you go from one coverage to another, they cannot deny anything for being pre-existing. They can't cancel a plan if a patient gets sick. No annual or lifetime dollar limits are allowed. That used to be a problem in the past when I first started at Be the Match many years ago. Families, these, expenses add up, and their plans would have a lifetime maximum. And then after they hit that, there was no more coverage. So that is no longer the case, thankfully. Young adults can stay on their plans until age 26 through the Affordable Care Act. And then it also has rules in regard to joining clinical trials or research studies, which they can't keep patients from joining. They can't raise costs because a patient joins, and they can't limit coverage for routine health. So things that are outside of what the research study is actually covering. So it is important, as you've heard again from Kirsten and Jillian, it's important to know your insurance. Every health insurance plan is different. It's very clear and obvious that the ALD community, you're all very well connected. And two families might have coverage through the same insurance plan. I don't mean to pick on, Blue Cross Blue Shield comes to mind. That's who I have. Someone else that another family member or another family could have also Blue Cross, but your plans could be entirely different. So it's really important to know that. And it's important to then learn what the coverage is for transplant and if it covers transplant for ALD. And then does it cover the cost to search for an unrelated donor or even test siblings or family members if that's a need? It's important to know things like what is your deductible, what's your co-insurance. So those are co-insurance is what you're going to pay if there's some type of a procedure done. Co-pays when you go to the doctor's office, your out-of-pocket max, and medication coverage. So it's important to know all of that. Does your plan help with transportation and temporary housing? As Kirsten mentioned, they had to travel all the way from Canada to Minnesota. So some plans do help with that, others do not. You've heard about transplant centers and staying in network. So it is important to know if you're staying in network, but if you don't, what is the appeals process if needed? Just like Jillian said. If you find yourself in a situation like that, I didn't mention at Be the Match in our patient support center, we do have an insurance navigator. And if your insurance company were to say, sorry, you're not in network and you wanted to work with the center that you want to go to appeal that, we can help out by providing data and information and what we call support letters to add to that appeal process that you go through. Tips for talking to your insurance. I think Kirsten, she went over most of these, truthfully. So our messages today are really well aligned, but ask to work with a case manager. So someone that's dedicated to your child's case. Write down their name, their phone number, take notes about what you discuss in case you end up needing to talk to someone else or refer back to that conversation. Ask for a copy of your insurance policy. Ask questions about transplant coverage. Again, back to the network. Am I required to stay within a certain network to get the highest level of benefits? If so, what are those centers? And then what is my coverage if we go out of network? But again, just like Jillian said and Kirsten said, don't take no for a final answer. Continue to work with them. Have the hospital that you're working with help you with your insurance company. And if you need help identifying transplant centers, Be the Match does have a transplant center directory on our website. It provides information about all of the hospitals that have access directly to search our registry. It has data about the number of transplants they performed, transplants and diseases that they've performed. And so then that's where you can find information on centers that do have a lot of expertise or experience working and transplanting patients with ALD. We do have some tools that we can offer to you if you're interested. The tables that you see on the slide here are actually some documents that we have that we could share with you if you're interested. It can help with financial planning and managing costs. So thinking about things like making a budget, taking a financial inventory, documenting or jotting down how to figure out what your out-of-pocket costs will be, learn how to manage debt. You can certainly, it's always an option to reach out to your funders and ask if they'll work with you with the situation that you're going through. Ask them if there's any way to lower your monthly payments. Keep track of receipts, lower your spending, and things like supplemental insurance plans, like Jillian mentioned, there are supplemental plans that can help with things when you or your child is hospitalized. It can provide payment directly to you for things like that, certain diseases. So these supplemental plans can help, and they pay directly to you as opposed to paying the transplant center. Getting financial help, we've heard about fundraising. I'm going to talk a little bit more about that on the next slide. Looking for grants, and what I would say is work very closely with your transplant center. They all should have a social worker that you can work with, and like Jillian said, you have to ask, but those social workers are there to help you and to help find resources. And then they should all have a transplant financial coordinator as well to help you gather some of this information. Paying for transplant, as we've heard about fundraising. We do see a lot of transplant families participate in fundraising activities to help with the out-of-pocket costs. Some tips to think about when you do decide to do fundraising or have others help you do fundraising is that just make sure it won't make you lose benefits from other programs. It does definitely work best when it's done earlier in the transplant process. Ask someone else to help lead the fundraising. You guys have so much on your plate already. It's not something that you need to lead. When people ask, what can we do to help? Fundraising is something that they could do. Keep the money in a separate account from your personal funds. Consider working with a fundraising organization. Both the ladies that you've heard from so far mentioned GoFundMe. And then if you want donations to be tax deductible, you do need to work with a tax exempt organization. On this next slide, these are 4 organizations that we do recommend to families if they want to do fundraising. They are all organizations that help transplant specific families. The first one, Children's Organ Transplant Association, is the only one that focuses on kids, but there are others that help with fundraising as well. The Bone Marrow Foundation, Help Hope Live, and then the National Foundation for Transplants. But again, a GoFundMe, other things through social media can absolutely help as well. I'm almost getting done. Just wanted to let you know again that at Be the Match, we do have a patient support center. We have other programs and resources that are available to help patients and families. And this is just a list of some of the things that we can help with. And then here's our contact information. If you have any questions, please do reach out to us. So I'll turn it back to Kelly after I start. Yeah.
Wonderful. Next, we have Emily.
Hello, my name is Emily Hardy, and I am a nurse care coordinator at the University of Utah Department of Pediatrics. I work with Dr. Joshua Wankowski, and we are working with and within Primary Children's Hospital in Utah, in Salt Lake. So I am so excited for this because I feel like this is the thing that I have the hardest time helping my families with. I know a lot about a few things, but I don't know in depth about everything. And so I feel like the advice that's already been shared has been very helpful, in line with like what I was already working on preparing. And I am so excited that I can share this with all of my families, and not just the ALD families. It's such a good resource, and I feel like so helpful. Let me share my slide. All right, can you see it? Perfect. And I did the wrong screen for me, but that's fine. We can still do this. So I just think for a minute, like, does this feel familiar to anybody that has a new diagnosis or is getting ready for transplant, or even just trying to figure out how, we're just in the monitoring phase. How did we spend our money this year? Because I'm doing my taxes and it says that I can maybe get a deduction, but I don't even know how much I spent, right? I think that this probably feels familiar to a lot of people. And as I was thinking about all of the things that are available to us, the thing that kept coming to my mind was the Mr. Rogers quote. He talked about having, it's like, the news was scary. And so when I was a boy and I would see scary things in the news, my mother would say to me, look for the helpers. You will always find people who are helping. And I feel like, I think somebody already mentioned, like, well, we didn't feel like we were that family. We didn't feel like we needed that help. And I think, like, this is not something that anybody can do on their own. Each aspect of this, there's people that have professions dedicated to, learning and doing almost every single different aspect of this. And so as a parent taking on all of it, it's so much. So use the resources, use the people that have been there before, the people that are dedicated to helping. And I think opening up to that idea of, like, you can't do it all will really be helpful for your family. Okay, next slide. So the great news is there's a path, right? So I don't know if anybody looks at this and says, oh yeah, like, I want to go on that hike. It's pretty treacherous. This is from Canyonlands National Park in central and southern Utah. It's really, really gorgeous, but there's a lot of hard stuff along the way. So just know that, like, when you do see all of this before you, that, like, you can still get where you're trying to go. So the first thing I want to mention, obviously, ALD Connect. So they just posted on social media recently about their the scholarship programs that they have. But what I wanted to say is use ALD Connect, connect with the peer support network, the peer-to-peer network there. They have resources, but I want to give a little caveat. There are a lot of local resources and community resources available to you. And if you can use some of those first for some of the things they have listed, either through your insurance or through, like, United Way has a lot of programs that the money that ALD gets, they can use for somebody that doesn't have access to these other resources. And I think, but at the same time, like, sometimes you're just out of time and energy to do that other work. So it's kind of a balance, but that was just a thought that I had as I was working through these. So the next place that we're going to go, this is going to turn into a shameless plug for the Department of Pediatrics at the University of Utah. I knew that this was a good resource. I've been using it for years as a care manager, but it's always been in different settings or very small. Like, I have a family that lives 2 hours north of here, and they need like a crisis nursery. What's available to them? And most of what I was doing was very Utah specific or a couple surrounding states. But as I've been in this role, and then even more as I was delving into the medical home portal, I realized, like, how big of a benefit this is. So it's I'll just read the slide. So it's a unique source of reliable information about children and youth with special healthcare needs, offering a one-stop shop for their families, physicians and medical home teams, and then other professionals and caregivers. And so it is built for everybody. So anybody can go to this site and learn so much and have tools that are available to them, even if, so for example, they have specific contracts with like Utah, Idaho, New Mexico, Nevada, Rhode Island, and Montana to provide state-specific resources and provider lists. But beyond that, when we were writing our leukodystrophy documents for this website, we had to pull out anything that was specific to our clinic process, because the whole idea is that it is a broad resource that everybody can access. And so many, the thing that is so great about this is you can go here and link out to so many of these other resources. And this is the one that I was so excited about. And I am so sad that I had not discovered this yet. So on their website, they have, if you go to the for parents and families and navigate to funding your child's special needs, there are these different sections here. And I was so excited because we've got, the first thing is appealing funding denials. And it walks you through how to appeal a funding denial and what some of the steps are, who you need to have on your team to work through that. And it really gives a great like step-by-step guide on how you can do that. There's understanding how your health insurance works. So it kind of gives more information about what Debbie was talking about, services for the uninsured or underinsured, and then more resources on understanding the Affordable Care Act. Now, I will say a lot of this, when it gets into insurance stuff, a lot of it is based like, you know, United States based, but that's still pretty broad audience. So on the financing your child's healthcare, it has details about like Medicaid, Medicare, and it's really like, it's high level, but enough that it breaks it out so that you have enough knowledge about the different programs. So under Medicaid, it talks about the waivers that are available in states for medically complex children. It talks about CHIP for the Children's Health Insurance Program. It gets into Social Security benefits, and on each one, it gives more detail. So if you needed more information about a specific place. Now, this is the thing that is the best ever. So all of the to talk about, we'll keep track of this, document that, make sure you write down who you talked to and when and about what did they say. So there is there's a care notebook that is available online through the medical home portal, and you can download it to your computer, you can print it off, or you can save it as a fillable PDF form. And you can put all of this information in. So here's our medical bill communication log. You know, who did we see? What's our account number? Oftentimes you'll have an account with the hospital for your labs. You'll have an account for the doctor's office that may or may not be at the hospital. You'll have an account for maybe home health. And so even though they're all at the same place, there's still so many different details to keep track of. And this can help you do that, as well as like medical expenses for like traveling, out-of-pocket expenses that you may be paying, like how much, you know, I paid $10 for this prescription, I paid $20 for that prescription, etc. And then we can just pause for 1 second and everyone can pull out their smartphone and open their camera if they want. And this will take you, it will link right to that care notebook. This is something that I was like, oh, like we need to like work on this at, you know, our leukodystrophy center. How can we make this better for our families? And then I'm just kicking myself that I didn't know that this part existed, because it is just such an awesome resource. And it's more than just this financial part. There's also just like, what are your kids' appointments? How do you document things for school? All of those types of things. All right, so we touched on insurance care managers earlier, and they are really great because they help guide you through all of the nuances of your healthcare plan and your child's needs, or as an adult, what your needs are. And I think they can really advocate for you. They're also advocating for the insurance oftentimes about, hey, like, instead of going to the emergency room, can we help you find the phone number for the on-call doctor? And some of those other options, but it really does help patients and families. And whenever I can get an insurance care manager to talk to, it really helps facilitate so many things for our families. So they'll help you understand your plan benefits. And when you're asking about like documents for your insurance, it's really important to ask, like, can I get the actual benefits information and what is actually covered? Because it will have a list of all of the things that are covered, what the exceptions are, and understanding that really can help you knowing going into different procedures, even for an MRI, like, do I have to have this, prior authorized or not? Starting with that document can really help allay a lot of like questions or fears. And then also they can help you find providers. They can help with prior authorizations, really kind of like moving things along. And then if you do have to get approvals for out of network care, and then travel and lodging reimbursement as well. And they may not be the one that like handles the actual reimbursement or that does actual approval, but they can help shepherd you through that process. Okay, and then the next is United Way. So United Way has, it's a nonprofit organization, and they have local United Way chapters all over the world. And each chapter within each area may have different things available. I know that like in Salt Lake City, Utah, and most of Utah, we have a very strong United Way network. And with that network, there's so many things that they can help with. 211.org, or in the United States, just dialing 211 can get you to, like, if you need help paying your utility bills, if you don't know where to go for mental health services and you feel like you've exhausted your energy trying to find things, you're going to connect to somebody that will help you connect to any of those services. So I think Jillian was talking about the in New Hampshire or somewhere where you can get the payment for like the healthcare premium, like what you're paying for your insurance. United Way is often a place where a lot of those types of programs are listed and that they can help you find. The next I want to talk about is like family voices or family to family networks. So there are organizations in every state in the United States, as well as some of the territories. And then they do have some family voices that are specific to some like indigenous people and like tribal lands. And these are community networks where you've got families who have children with disabilities and special healthcare needs that work together with you to help you advocate for your kids. And they also help advocate like on the state and national level as well. But a big thing with this is these are the parents that have done it in your area. So these are the parents that have navigated appointments. These are the parents that have navigated Medicaid in your state, or navigated specific health insurance plans, or working with different providers. The next one, so I only named one. There are so many different support groups available, but look for your local support groups. So the Utah Kids Foundation, that is supported through the Utah Parent Center, which is a family to family network, Family Voices. And it's a moderated Facebook group, and people ask all the questions and people answer all of the questions. And it's just a really awesome place where you can really get some of these like local resources. So check with people in your area, see what kind of groups are available. That, yes, these patient organizations that we're a part of with ALD Connect and others, they're really great, and really hone in on some of those local resources. So for example, there's a storage closet, they call it, which is actually a storage unit. And people that have extra medical supplies that they don't need anymore donate. And then it's moderated through this Facebook group and other ways to ask for it. And so, you know, sometimes it's like, hey, does anybody have a shower chair? And, you know, they all direct them. They're like, if you have a request, go to this person. And then she's like, hey, yes, we've got one, you know, we'll connect. Lots of things like that are available in different areas. So reach out and seek out those opportunities. And then the last one that I've got is, maybe if it'll move. Oh, guys, it's frozen. Sorry, 1 second. So I just wanted to, I think the last one's a picture of my kid holding a lizard in some Red Rock country. And, you know, even though it's hard, there's a lot that you're gonna have to figure out and go through, you can always find some of those gems and some of those little rewards during this process. So that's what I've got. Thank you.
Thank you, Emily. We're about at time, but there's a few questions in the chat. It looks like they're for you, Jillian.
Let me pull it up. So I saw one. Okay. Do you know if non-cerebral boys can qualify for secondary insurance ahead of time? So what I was told in New Hampshire, and again, it's all different state to state, you need to make sure that they understand that ALD is considered a terminal brain disease. We know that that's not the case. We're not going to call it that, but that is what it's under. So you need to let them know that. I was told yes. Once they have the diagnosis, that is where it is. Grady did fall into some more categories because he does have other disabilities, but basically, yes, you just need to fight and ask and have doctors write letters, maybe go through the Be the Match backup letters also, which is wonderful. And then someone asked if there's more information online about the HIP program. So in New Hampshire, it's called HIP program, HIPP, Health Insurance Premium Payment. I know some states they're called different things, but it's basically the same thing. It would be online, or you can call your state Medicaid office and ask them about that. But I believe most of the Medicaids do have something similar.
Great, thank you.
And again, don't take no, keep on applying, because it took us 1.5 years to get approved for these things. You will get it eventually.
That's great advice. Well, I just want to say thank you to all of our panelists, and again, thank Global Dean for making this webinar possible. It looks like we've got to transition to the next sessions, so we'll have to end and then pick up with some additional webinars soon. Thank you.